As we age, while striving to maintain heart health, bone strength, and mental clarity, we often overlook one of the most critical foundations of our mobility and independence, our feet. These tireless workhorses, carrying us through decades of life, frequently go unnoticed until discomfort or weakness forces us to pay attention. For older adults, foot health isn't just a matter of comfort. It's a cornerstone of independence, balance, and a high quality of life. Foot problems in old age are common and profoundly impact overall health. Age-related muscle loss, known as sarcopenia, weakens the feet and legs, turning each step into a small challenge. Joint stiffness, cartilage wear, and tear, and chronic inflammation limit the range of motion and increase the risk of falls, which can have serious consequences. Circulatory problems and impaired nerve function can cause numbness, slow wound healing, and other complications, especially in people with diabetes. However, there's no need to despair, as there's a powerful ally in the fight for foot health: proper nutrition. While the focus is usually on vitamins and minerals like calcium, vitamin D, and magnesium, there's a whole group of equally important non-vitamin and non-mineral compounds that play a key role in maintaining the strength, structure, and functionality of the feet. What specific nutrients can protect and restore foot health, ensuring an active and fulfilling longevity? The answer to this question may surprise many who are used to relying on traditional vitamin complexes. Let's turn our attention to protein, the cornerstone of health and longevity. Over time, some of the first signs of aging often appear in the feet. Climbing stairs becomes a real challenge, long walks lead to exhaustion, and simply getting up from a chair requires tremendous effort. These subtle transformations often signal the onset of sarcopenia, the steady loss of muscle mass and strength, affecting up to a third of people over the age of 60. But is this physical decline an inevitable fate, or can we curb its onslaught? In other words, can a single nutrient help us maintain the strength and vigor of our legs, despite the relentless march of time? The answer is yes, and the name of this miraculous element is protein. Protein isn't just for bodybuilders and athletes. For older adults, it's a fundamental component of healthy aging, especially when it comes to the functionality of the lower extremities. Our muscles are made of protein, and as we age, our bodies lose the ability to effectively use it for repair and regeneration. This phenomenon, known as anabolic resistance, means that the body needs more high-quality protein to achieve the same muscle building response that once came easily. This is where protein shines, acting as a true powerhouse. It provides the building blocks to maintain muscle mass, which is crucial for leg strength, balance, and mobility. The role of leucine, an essential amino acid that acts as a kind of biological key and is abundant in dairy products, eggs, and lean meats, deserves special attention. Leucine activates a key growth mechanism in the body known as mTOR, sending a clear signal to cells to begin the muscle-building process. Without this signal, even a diet rich in protein may not be enough to maintain muscle tissue, which is especially important for maintaining foot health in older age. What are the consequences of insufficient leucine intake? The process of muscle degradation may be gradual, but its consequences are significant. Weakened legs, increased risk of falls, reduced overall mobility, slower recovery from injuries, and as a result, increased dependence on outside assistance. Even with sufficient calorie intake, protein deficiency can lead to the unnoticed breakdown of muscles, which are replaced not by strength and endurance, but by a feeling of constant fatigue. Fortunately, this problem can be solved by taking proactive measures. Modern scientific research indicates that older adults should increase their protein intake compared to previously recommended levels, increasing it to 1.2 to 1.5 grams per kilogram of body weight per day, distributing this amount evenly throughout the day to counteract so-called anabolic resistance. Instead of concentrating protein consumption in the evening, ensure an adequate intake of this amino acid with each meal, especially during breakfast and lunch, when many older adults tend to skimp on the protein component of their diet. The choice of protein sources is also important. Leucine-rich foods such as Whey, eggs, fish, chicken, and Greek yogurt are particularly effective. Plant-based alternatives such as tofu, lentils, and quinoa can also be beneficial if properly combined. For people with reduced appetite or difficulty chewing, protein shakes and powders are an excellent solution, offering a convenient and concentrated alternative. Secondly, pay attention to omega-3 fatty acids. The word fat often conjures thoughts of harm and the need to avoid its consumption. However, there is a special type of fat that can have a beneficial effect on the body. Omega-3 fatty acids have unique properties. They can relieve joint pain, improve blood circulation in the lower extremities, and protect the nerve fibers that enable every movement. That's why their role in maintaining leg health is especially important. Pain, stiffness, and swelling in the legs are common in older adults and are usually associated with chronic low-grade inflammation. Regardless of the cause of discomfort, arthritis in the knees, aching calves, or painful ankles, inflammation is often a hidden factor that worsens the condition and limits leg mobility. In this situation, omega-3 fatty acids act as a natural and long-term anti-inflammatory agent. Unlike painkillers, which only temporarily block pain, omega-3 fatty acids act on the body from the inside, gently reducing the inflammatory response at the cellular level. Eicosapentaenoic acid, EPA, and docosahexaenoic acid, or DHA, the two most active forms of omega-3 found in fish oil, affect the production of signaling molecules known as eicosanoids and resolvins. These compounds help stop the inflammatory process. As a result, joints become more mobile, swelling and stiffness decrease, and legs feel less tired from chronic discomfort. However, the beneficial effects of omega-3 are not limited to fighting inflammation. Over time, blood circulation in the lower extremities naturally deteriorates. The smallest capillaries responsible for delivering oxygen and nutrients to the feet and lower legs function less efficiently, which can lead to cold feet, muscle spasms, delayed healing of injuries, and even more serious complications in people with diabetes or peripheral artery disease. Omega-3 acids have a positive effect, improving the condition of the endothelium, the inner lining of blood vessels. They stimulate vasodilation, thereby supporting free blood flow and preventing blood clots. This means that more oxygen and nutrients reach the muscles, nerves, and skin of the legs. Improving blood circulation is not just a comfortable feeling. It creates a foundation for strengthening legs, accelerating recovery, and reducing the risk of complications. In addition, there is good reason to believe that omega-3s may play a protective role in maintaining the health of the nervous system, especially for those who experience unpleasant sensations such as tingling, burning, or numbness in the legs, common symptoms of peripheral neuropathy. This is achieved by reducing oxidative stress and stimulating the regeneration of nerve cells. Omega-3s help maintain sensitivity and reduce discomfort in the lower extremities. This is especially important for older adults with diabetes or vascular disease, as loss of sensation can lead to unnoticed injuries or infections. So, where can you find this valuable fat, so essential for health? The best sources are fatty cold water fish, such as salmon, mackerel, sardines, and anchovies, which are high in EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. For those who do not eat fish regularly, there are effective alternatives in the form of purified fish oil supplements or algae oil, which is a vegan option. Although the optimal dosage varies depending on individual needs, numerous studies confirm that consuming 1,000 to 2,000 milligrams of combined EPA and DHA per day has beneficial effects on the cardiovascular system and has anti-inflammatory properties. Next, let's consider collagen. It may be invisible, but beneath every confident stride, flexible knee, and stable ankle lies an unseen framework: collagen. It intricately weaves through tendons, cushions, joints, and lends elasticity to ligaments. It quite literally holds legs together. Over time, however, this structural foundation gradually weakens. Joints begin to ache, knees lose their former suppleness, and legs forfeit the sense of stability and resilience they once possessed in youth. The question then arises, is it possible to restore what time has eroded? Can collagen recapture the former strength of aging legs? The answer is encouraging, and it starts with collagen peptides. Collagen, this ubiquitous protein, is the bedrock of connective tissue in the human body. However, beginning in the fourth decade of life, the body's collagen production begins a steady decline. By the sixth or seventh decade, this reduction becomes palpable, manifesting as creaky knees and less resilient tendons. Unlike muscle mass, which can be regained through exercise and diet, collagen loss occurs gradually but with serious consequences. In this context, collagen peptides become a valuable tool. Unlike regular dietary collagen, these hydrated peptides are broken down into short chains of amino acids, making them significantly easier to absorb into the bloodstream. Once in the circulatory system, they don't just dissolve. They are directed to joints and connective tissues, where they act as signaling molecules, stimulating the body's natural collagen production. Clinical studies have shown that regular consumption of collagen peptides leads to reduced joint pain, increased flexibility, and even improved bone mineral density. This translates to greater knee stability, more secure ankles, and a reduced risk of soft tissue injuries, which heal much more slowly in older adults. However, the role of collagen is not limited to just strength. It plays a vital role in ensuring freedom of movement. When tissues rich in collagen are in good condition, movements become smoother. The knee moves without friction, the Achilles tendon flexes without inflammation, and the plantar fascia supports each step without excessive strain. All these small but important details of lower limb function depend on a healthy collagen structure. However, it should be emphasized that collagen does not function alone. To achieve maximum effectiveness, it needs key essentials, in particular vitamin C, which plays the role of a catalyst in the process of collagen synthesis. Without sufficient amounts of this vitamin, the body will not be able to effectively produce or restore collagen, regardless of the amount consumed. That is why many manufacturers of high-quality collagen supplements include vitamin C in their composition or recommend using them in combination with foods rich in this vitamin, such as citrus fruits or sweet peppers. It is also important to consider the timing and regularity of taking supplements. The most noticeable clinical improvements are observed with daily collagen intake for 8-12 weeks. Regarding sources of collagen peptides are most often obtained from cattle, marine fish, or pigs. They all contain essential amino acids, such as glycine, proline, and hydroxyproline, which play an important role in the restoration of connective tissue. However, marine collagen is often noted for its superior digestibility. At the same time, bovine collagen remains the most studied in terms of supporting joint and bone health. Fourth, it is worth paying attention to creatine, a substance capable of returning energy to cells, nourishing strong and resilient legs, especially in adulthood. Creatine, often mistakenly perceived as just a supplement for bodybuilders, is increasingly recognized as a powerful tool for maintaining health during aging. At its core, creatine is a natural compound that accumulates in muscles and serves as a kind of reserve energy source. Every time a person stands, rises, or lifts something, especially during rapid and intense movements, the muscles use creatine to restore ATP, the molecule that provides energy for muscle contractions. This is similar to having a backup generator for your legs. However, with age, the body's natural creatine stores are depleted, which leads to a decrease in the ability to generate rapid and efficient energy during movement. As a result, the legs tire faster, walking speed slows down, and there is a gradual but dangerous deterioration in balance and confidence. But there is good news. Creatine is one of the most studied and effective supplements capable of reversing age-related changes in muscles. Research indicates that even when combined with moderate strength training, creatine promotes increased lower body strength, muscle mass, and functional performance in older adults. Meta-analyses demonstrate that seniors who took creatine during regular exercise significantly improved their walking speed, chair stand time, and leg strength compared to those who did not take the supplement. Moreover, even in sedentary individuals or those suffering from frailty, creatine appears to help maintain muscle mass, providing a baseline level of strength to the legs even without intensive training. The beneficial properties of creatine extend far beyond simply strengthening muscles. The latest scientific research suggests its ability to support bone density, which appears to be due to the increasing force of muscle impact on bones as they strengthen. This is especially relevant for the lower extremities, which bear the weight of the entire body and are most at risk of fractures from falls. Strengthening muscles entails strengthening bones, and creatine plays a role in providing nutritional support in this process. Unlike other nutrients, which can take months to show any noticeable changes from intake, the effects of creatine are often felt within weeks. Consumers report a boost of energy during walks, increased stability when getting up from a chair, and an overall sense of restored lower extremity functionality. How should creatine be taken? The most common form is creatine monohydrate, a well-studied and affordable option. A daily dose of 3 to 5 grams is generally effective and safe for older adults. There is no need for a loading phase or cycling. Consistency is key. The supplement can be mixed with water or added to smoothies, and it is recommended to take it with food for better. Absorption. What about side effects? Creatine has been thoroughly researched, and when recommended dosages are followed, it is considered completely safe, even for older adults. A slight retention of fluid in the body may occur at the initial stage of intake, but this phenomenon usually passes quickly. It is important to emphasize that concerns about negative effects on the kidneys in healthy individuals have been largely refuted in clinical trials. Fifth, it is worth paying attention to glucosamine. This nutrient may not have a flashy advertising campaign or be positioned as a trendy means of improving athletic performance, but for decades it has held a strong position as one of the most thoroughly studied substances supporting joint health. Glucosamine is particularly important in the context of osteoarthritis, a progressive degradation of cartilage tissue affecting millions of older adults. The uniqueness of glucosamine lies in its role not simply as a pain reliever, but as a fundamental building block, a structural element of the molecules that form cartilage, synovial fluid, and connective tissues. It can be compared to the raw materials needed to repair joints. Over time, the body loses its ability to maintain and regenerate cartilage tissue. This leads to thinning of the articular surfaces, inflammation, stiffness, and pain, especially in joints bearing the main load, such as the knees. The knees take on the main weight of the body. Glucosamine promotes the natural production of cartilage tissue in the body and supports the consistency of synovial fluid, which provides lubrication and nutrition to the joints from the inside. Numerous long-term studies, including those analyzing Cochrane meta-analyses, have demonstrated the ability of glucosamine, especially in sulfate form, to reduce joint pain and slow the progression of cartilage destruction, primarily in the knee. Although most studies focus on the knee joint, the principles of glucosamine's action apply to smaller joints, such as the ankles and feet, where cartilage destruction can lead to equally serious consequences. However, perhaps the most overlooked property of glucosamine is its stabilizing effect on the joints. Unlike short-lived methods that only dull pain, glucosamine provides deep support to the structure of the joint. Its action unfolds gradually, strengthening the internal skeleton of the joint over time. People taking glucosamine often report subtle but noticeable improvements. Crackling decreases, bending becomes easier, movements become smoother, and confidence appears in everyday activities, such as climbing stairs or walking on uneven terrain. Glucosamine pairs well with chondroitin, another substance that supports healthy cartilage. When used together, they demonstrate modest but consistent improvements in joint mobility and comfort. However, glucosamine is valuable on its own, especially when started early, before joint damage becomes irreversible. It's more of a long-term solution than a quick fix, but for those whose legs aren't as young as they used to be, this approach proves to be the most beneficial. How should glucosamine be taken? A typical Recommendation is 1,500 milligrams of glucosamine sulfate per day, divided into 2 or 3 doses with meals. Noticeable improvements may take 4 or 8 weeks, so consistency is crucial. Glucosamine is generally well tolerated, but those with seafood allergies should exercise caution, as some supplements are derived from shellfish. Fortunately, many plant-based or synthetic alternatives are now available. Sixth, let's discuss curcumin, a substance used for centuries in traditional medicine practices like Ayurveda and Chinese herbal medicine. Curcumin has recently gained widespread attention for its potent anti-inflammatory and antioxidant properties. This isn't just folklore. Modern science has validated curcumin's effectiveness in hundreds of studies, many focusing on its role in combating chronic joint and muscle conditions. In particular, curcumin has shown promising results in treating osteoarthritis, tendinitis, and inflammatory pain syndromes that often affect the legs and lower extremities in older adults. How does it work? At the cellular level, curcumin interrupts the inflammatory process by blocking key enzymes like COX-2 and 5-LOX, as well as signaling molecules such as TNF-alpha and interleukins, which perpetuate swelling and pain. Unlike conventional nonsteroidal anti-inflammatory drugs, NSAIDs, which often cause gastrointestinal side effects or carry long-term risks, curcumin has a gentler impact on the body, especially when taken in optimized forms. Clinical trials have even shown curcumin to be as effective as ibuprofen in reducing joint pain and stiffness in arthritis patients, but with a significantly better safety profile. For aging legs, this translates to reduced swelling in the knees, less tension in overworked tendons, and increased comfort during movement. This is especially helpful for conditions like plantar fasciitis, where inflammation in the thick band of tissue along the bottom of the foot causes heel pain with every step, a condition known to be difficult to treat. Curcumin's ability to modulate pain and promote tissue recovery makes it one of the few natural compounds that not only reduces symptoms, but may also help address the underlying causes of ailments. Beyond its beneficial effects on joints and tendons, curcumin's antioxidant properties provide comprehensive protection for the body. As we age, muscles and nerve fibers are continuously exposed to free radicals, unstable molecules that damage tissues over time. Curcumin, with its ability to neutralize these harmful radicals, can help preserve muscle tissue integrity and support a healthy nervous system. This is particularly important for preventing numbness and neuropathic pain, commonly seen in individuals with diabetes or circulatory problems. However, a long-standing issue has been the low bioavailability of curcumin in its natural form, which hinders its absorption into the bloodstream. Fortunately, modern scientific advancements have led to the creation of enhanced formulations, such as curcumin with piperine, black pepper extract, phytosomal curcumin, and nanocurcumin. These advanced versions significantly improve curcumin's absorption rate, making its therapeutic potential more accessible. To support joint health and reduce inflammation, a typical recommendation is 500 to 1,000 milligrams of standardized curcumin extract per day, although individual needs may vary. With regular intake, most people notice positive changes within 4 to 6 weeks. Curcumin is not a quick fix, but a solid step toward improved well-being and mobility. In conclusion of this informative journey, 6 essential nutrients have been explored, each performing its own scientifically supported role in maintaining the health of the lower extremities. Protein serves as the foundation for preserving and restoring muscle tissue, aiding and regaining strength that the relentless aging process seeks to take away. Omega-3 fatty acids wage an uncompromising battle against chronic inflammation, which, like chains, binds the joints and slows blood flow, allowing blood to circulate freely and legs to move with less discomfort. Collagen peptides strengthen tendons, ligaments, and cartilage, which provide legs with structure and stability, significantly improving mobility and joint comfort. Creatine, in turn, activates the muscle energy system, filling each step with new strength and endurance, which is especially important for preventing falls and maintaining independence in old age. Glucosamine supports the restoration and protection of cartilage tissue in the joints, softening each movement and maintaining flexibility despite the passage of time. Finally, curcumin provides natural relief from chronic inflammation and pain, offering a gentle but effective way to maintain freedom of movement in the legs, even in the presence of chronic diseases. Without a doubt, every person is unique. Before including any new supplements in your diet, it is wise to seek the advice of your doctor, especially if you have any medical conditions or are taking prescription medications. Individual recommendations will ensure that these nutrients benefit you safely and effectively. The path to leg health does not begin with surgery, injections, or passively waiting for the condition to worsen. It starts with proper nutrition, with conscious choices made gradually. Now, a person has the necessary knowledge, scientific data, and most importantly, the opportunity to act. It is necessary to provide the legs with what they really need and allow them to carry a person forward with greater strength than ever before.